Hello friends, if you have been losing hair for a while now, you must have heard about this medicine called Minoxidil. So it is one of the FDA approved medicine which is today available, and we will be discussing more about it now. My name is Dr. Arun Panda. I am a facial plastic surgeon and I practice in Navi, Mumbai. We talk about a lot of products, medicines and therapies regarding hair loss and hair restoration surgeries. So let me just give you a brief idea about what a minoxidil is and how it basically works. So as I mentioned, there are surgical modalities and non-surgical modalities for hair loss. Surgical modalities includes the hair transplant surgery, which we do by FUE or FUET technique. And patients who do not require surgical hair restoration, we treat them by non-surgical modalities, by medicines, by laser therapies, by PRP therapies, etc. So minoxidil is one of the FDA approved medicines which is given for hair loss. So ideally, it started with, this minoxidil was given to patients with blood pressure, high blood pressure. And it was found that those people who were using this medicine, they could see more of hair growth in them. So then it started being used in the field of trichology, and it has shown very good results. So as I mentioned, it is one of the two FDA approved medicine which is indicated for non-surgical hair restoration. So how does it basically work? So minoxidil actually is a potassium channel opener. So means it kind of improves, or it works on the smooth muscles there in the scalp, and it opens up or it dilates the blood vessels there, and there is increased blood supply to the scalp, and there is increased nutrition to the scalp, and that is how it starts growing. Now we have to understand how does this work. So we all know that the hair is basically, it grows in a cycle. So there is an anagen phase wherein the hair keeps on growing, and then there is a catagen where it goes in rest, and then it goes into a telogen phase, and then it falls off. So anagen phase is the growing phase, which is about 3 to 5 years. The hair keeps on growing, and then it goes into the catagen, which is about 3 to 4 months, and then the telogen phase, and then it falls off. So every hair has to go in that cycle basically. So what minoxidil does is basically it pushes those hair follicles which are in the telogen phase or the catagen phase, they are sleeping, they push them to the growing phase. So that is how it basically works. The patients normally, once they start using minoxidil, they say, doctor, we have suddenly the hair fall has increased. It has to increase for the first 2 months. The reason is basically it is pushing those hair follicles from the catagen and telogen phase into the growing phase or the anagen phase. So obviously it has to fall, and then the follicle produces new hair, or it pushes it into the anagen phase. So there is absolutely nothing to panic about once you start using minoxidil. A lot of our patients, they get scared and they stop using minoxidil. No, that is not how it works. So you got to use minoxidil for a long period of time. So that's one complaint which patients have. Second thing, how long you are supposed to use? You have to actually use for a lifelong, as long as you want your hair. But there is a small problem. So there is something called as a tolerance. So patients normally get a tolerance to minoxidil. So we have devised certain programs wherein like the tolerance is not there. What does tolerance means? Tolerance means after a year or so, minoxidil stops working. So what we normally suggest our patients is basically maybe for the first 2 months we start using it regularly, and then we start reducing it, say maybe once in 2 days or something like that, or once we stop them after a few months, and we put the patients on certain hair serums, and then we get back to minoxidil and things like that, so that the tolerance is it doesn't come very fast. Now talking about the strengths of minoxidil, minoxidil comes in various strengths. Today it is available as 2%, 5%, 10%, 12.5%, 15%. But according to my experience, I think for a female 2% is more than sufficient, and for a male 5% is more than sufficient. We do not actually require more than that. So if you start using as a male, I think 5% is more than sufficient, and for a female 2% is more than sufficient. A lot of females who use minoxidil, they start complaining about hair growth from the ears, from this area of the scalp, from the nose. So it's called as a hypertrichosis. So we normally tell the patients, you use your fingers to apply on the scalp and then wash it nicely. The minoxidil should not kind of drip down onto the scalp areas. That's very important, because wherever it because we all know face, everywhere there are hair follicles. So if there is minoxidil going there, it has to cause hair growth. So you have to be very cautious when you're using minoxidil. Minoxidil, as I said, it comes in solution form, foam form. A lot of patients complain of dryness of the skin, of the scalp once they start using minoxidil, and they have flakes of the skin coming out. So always try and use a minoxidil which is alcohol free. So that actually helps not to have that kind of dryness, and not to have kind of that flakiness falling off from your scalp. Always use minoxidil in your dry scalp. I mean, what I'm trying to say is it should not be wet. You should be using that. So as I said, there are other modalities of treatment for hair loss also. So this is one of the FDA approved medicines which is kind of prescribed for hair loss. If you want to know more about the other non-surgical hair modalities, please keep on seeing and following my videos. You will be finding more information about other non-surgical modalities of the treatment. If you like my video, please do not forget to share, like, and do subscribe to my channel to keep on getting updates about hair restoration, non-surgical, surgical, and other facial cosmetic surgical treatments. Thank you so much for watching us. Dr. Arun Panda, facial plastic surgeon, Mumbai. Thank you.